Look who's back in the house. Speaking of eyes, up next in Look Good, Feel Better. It is all about eyes. Wait till you see what this team is going to do in-house while you watch. It's next on What's Happening in Health. Hey everybody, good morning. Thank you for joining us here on What's Happening in Health. This is a really unique show today. Take a look at this. Got a live team in-house. Say hello to Dr. John Mendelsohn and Hope Merz from the Advanced Cosmetic Surgery and Laser Center. They are prepping our patient now for a live treatment to give you better looking eyes. You're going to be able to watch it happen. We'll share more from them in just a little while on our program. Hey everybody, welcome back. It is time for Look Good, Feel Better today, and I'm so excited because joining us now live in studio, the team from the Advanced Cosmetic Surgery and Laser Center, Dr. John Mendelsohn and nurse practitioner Hope Merz. Good morning to both of you.
Good morning.
Okay, so John, we know you've been one of the most supportive people of our show. We love to showcase your work. I know Hope's a new addition, so because we're going to have her start working, just tell us a little bit about what her role is, what she's doing here, and then we'll kind of get you to work.
Sure. So Hope comes from a dermatology background. So for the past 7 years in Cincinnati, she's done a lot of medical and cosmetic dermatology. We're going to see some of the things that she's an expert at today. Injectable fillers, Botox, lots of skincare, microneedling, PRP.
But I also think it's important, so you do some of the basic dermatology things, because people ask me all the time.
I do. Anything from skin cancer identification to biopsying and treatment for that, as well as skin care, skin rejuvenation, and laser therapies, injectables.
Which is excellent, because I certainly send you people with those basic questions that are really important. Okay, turn that on just so we can hear it. This is what we have to look forward to. Yeah, you hear that buzzing? We're going to do something before the end of this on the vampire facelift. But first, we want to tell you, you worked with our patient here on some eyelid things, correct?
We did.
So let's talk about what did you do? Because we've got video to show you of our first procedure. So what did you do?
Sure. So we performed what's called an upper blepharoplasty, or an upper eyelid procedure. And as you can see, first of all, eyelid rejuvenation is one of the best things anybody can do. The idea here is to remove the redundant or extra eyelid skin. What you see is a marking of the eyelids, and surgically, we're removing the excess upper eyelid region.
Now, I know that doesn't look pretty, but it's all numb and you don't feel it, right?
All right, so this is a procedure performed under local anesthesia. It takes about 20-25 minutes to perform, and basically, patients come in, take a little Valium, we'll go ahead and localize the area. We'll numb it up just like you would a little skin cancer, a little mole. We'll wait a few minutes, and as you saw, we'll simply excise that skin. We use one stitch, one suture goes back and forth underneath the skin. A little tiny knot is tied on each side, and it's removed about 6 days later.
Okay, so this is the removal then that we're seeing there.
Right, so you can see she's clipping the little knot in the center, and she's simply going to slide the suture out.
And I know that our patient doesn't really want to talk, but I have to ask, was it painful along the way, or was it okay? You can just kind of give me a yes or a no.
It was not painful. I didn't feel a thing.
Okay, so she said it wasn't painful. She's not Mike, but that's her story. We're sticking to it. Okay, so from there then, you also had some before and afters of hers. And I have to say, she didn't look bad before, but man, there was a dramatic difference. Look at that. Yeah. So is that the goal?
The goal is to look more refreshed. It's not to look like Kenny Rogers or startled or like.
We have seen the surprise look quite often.
But you can see with Jill, you can see just how much brighter her eyes are, and another patient,
yeah.
Karen, you can see it really does a lot. When we communicate with our eyes, and they've done a lot of studies looking at the saccadic movements of our eyes. That is how we communicate with each other. And a lot of information is shared. Are you tired, angry, sad? And so when patients come in, they're often saying, you know, I feel good, I'm taking care of myself, but what can I do?
Okay.
This is one of the single best things anyone can do.
I'm noticing that, and a lot of these people, we think, you know, well, you have to be old or whatever. You don't. So then you sort of add to this. So you have a couple things that you can show us here. One of them is called PRP. So tell me, what is PRP? And we're going to kind of let you go to work so we can watch you work a little bit.
Sure. So PRP stands for platelet-rich plasma. This is an element in all of our bodies and all of our blood serum that has natural healing elements and collagen stimulators. So we can concentrate that at our office and inject it where we need it.
Okay, so you are going to do a little bit of that with her because you brought some of this blood. But Dr. John, talk us through. We saw you take the blood out, and then she's walking to what I call it the spinner, but there's a professional name for it.
Right, it's called the centrifuge, but we can call it a spinner. So what we're doing is we're removing blood from a patient, as you saw, and we'll spin it down in this centrifuge. The spinner will separate the blood into what we call platelet-rich and platelet-poor blood. So platelets, as you may know, are one of the first cells to come to the area if you were to cut yourself to stop the bleeding.
Okay, so let's get out of that video and see, because then what she's doing is injecting that in. So tell us, kind of talk us through there.
Sure, so what I'm actually doing is making a little tiny hole with a small needle. This is her platelet-rich plasma, thank you very much. And it has just a little, it looks like a little noodle on the end of there. It's a cannula. So.
Okay. And then by putting that in, John, what is it
So
doing?
the platelet-rich plasma that we spun down contains a lot of what we call growth factors or wound healing factors. So it's what this is doing, it's like triggering a response to injury where the tissue will be regenerated and remodeled.
And when does it show up?
Well, you'll see some immediate results, but that's more from the volume. Usually it takes about at least 10 weeks to begin to see the process, and it continues for about 4 months, actually.
And, you know, it's a little hard because if you're a needle phobic person, we know it's hard to watch, but she's kind of numb under the eye, so we're not feeling that.
And this is a cannula, it's not a needle, so it's blunt. She made
Okay.
a little hole just to place the cannula, and now she's filling in what we call the tear trough area. We talked about upper eyelid rejuvenation. The reason why we use a lot of non-surgical treatments in the lower eyelid is a lower blepharoplasty often isn't required these days. We want to fill in this area. If you see Jill here, she has something called a tear trough. There's actually a concave or a sunken in region.
So you lifted the top, but you're filling the bottom, is
Correct.
what you're saying.
Right.
Yeah. And then it's rejuvenating from the PRP, correct?
Absolutely, that is
okay.
correct.
So she looks fabulous. We're not saying she needed this done, but then you also mentioned to me, it's Halloween time, so we have talked about this thing where you also use the what do you call it?
Microneedling.
Microneedling. Okay, so on the other side of her face, we can hear and show this kind of cool thing.
Sure.
And would you use both of these?
They're often used in combination, yes. The PRP is being injected to induce new tissue and collagen. Topically, you'll see by creating some injury to the topical surface, we'll be stimulating cells.
Okay, so she took some of that blood that was in there, which is her blood, that was the already enhanced as the PRP and the platelet-rich protein, correct?
Yes,
Or
yes.
platelet-rich plasma.
Platelet-rich
sorry about
plasma.
that. And then what you're doing now is topically putting that on, correct?
Correct. So this microneedle actually is going to drive this down into the top portion of her skin.
Okay. So I know that this sort of gives a redness to it, and
Yes.
that's why they call it the vampire facelift, because
Yes.
you actually see what, John?
Well, you're going to see a little bit of bleeding, so they coined it the vampire facelift. That's really from the PRP more than the microneedling. But the microneedling is stimulating the superficial layers of the skin. They stimulate cells called fibroblasts to produce more collagen. So this is a wonderful tissue regeneration, skin rejuvenation procedure.
Now, when I've seen this, you do it over the whole eye, the whole face. What do you do?
You treat the
Oh,
whole
yes.
face. Yep, go ahead.
Face, neck, chest. It does great around the perioral lines here.
Oh,
So, yeah, we
getting
can
rid
go
of the
everywhere.
fine lines. Okay, so we got to see you. You're
Yes.
actually dipping it in her.
I'm putting more on there, more of this good stuff right onto that skin
And the
layer.
good stuff again is?
The PRP. We're
Yeah.
trying to impregnate, right, the PRP into the injured area that Hope's creating with the microneedling.
Okay, so again, how long will it be before we see results on something like that?
Well, her skin will look pretty good over the next couple of days. It will look bright and youthful. This is something that's usually done in a series. You'll probably have 3 or 4 treatments, maybe periodically, anywhere from maybe 4 to 6 weeks apart. This is also done as maintenance, but you can treat some of the photoaging, some of the brown areas, as well as some of the fine lines. We love it in the lower eyelid area. As Hope said, we love it around the mouth as well for some of these lip lines.
Okay, so just in conclusion, we started with the eyelid upper lift.
Upper blepharoplasty.
And then we followed it with?
We followed it with treatment for the skin, which also addresses the lower eyelid with PRP, platelet-rich plasma, injections, and microneedling.
And so in 10 weeks, we're going to do a follow-up here, and we're going to see a little bit more on what her face looks like, because that will be the true test, all right?
Yes, let me say one quick thing just about injectable fillers in general. PRP is great. It induces collagen enhancement. Some of the Voluma, Velour, Volbella, hyaluronic acids are wonderful in this area for people who don't want to undergo any of this. It's a simple injection in the office, and the products last up to 2 years.
Okay, so if your blood isn't your thing, we can use this. All right, we know that you guys have lots of things and you've been real supportive. We have a link to Dr. Mendelsohn's team at the Advanced Cosmetic Surgery and Laser Center. I know through the end of October you're doing low-cost Botox and a few things, so we hope people will reach out to and give you a call. Thanks for being gutsy and coming in and doing stuff live on TV. All new for all of us, but we appreciate it. This came out really great. All right, up next.